Yes, your insurance does provide some services at zero cost to you. They're called preventive services. So today let's go over part 1 for babies to age 18. What are the basics? What is covered? And some tips to help you along. Welcome, I am the Medical Bill Whisperer, a previous billing manager turned patient advocate. I am committed to bringing answers, insights, and solutions to patients like you. First, a disclaimer. If you have Medicare, Medicare Advantage, Medicaid, or TRICARE, you have your own rules, guidelines, and services. This does not apply to you. So who is eligible? Well, any commercial plan bought on an Obama marketplace or exchange. Any plan that you bought on an open market through an agent. And most commercial ERISA plan, the self-funded plans where your employer determines what benefits your policy covers and pays for. So the great news about those preventive services is that your insurance plan is mandated to cover the services without charging you $1. Even if your deductible, co-insurance have not been met, even if you have a usual visit copay per your plan, it doesn't matter. You pay nothing. Yay! Let's start today with babies and very young children. What are covered? Well, baby visits are, and they go through a range of screenings, assessments, services, labs, etc. For example, developmental screenings, blood pressure screenings, BMI measurements to see if your child meets the established medical guideline for his or her age. There are also some screenings through blood testing, including sickle cell disease or tuberculosis and other things I will not try to even pronounce here. Immunizations, there are quite a few of them, and they are all covered at zero cost to you. During those well visits, vision and hearing screenings will also be performed, as well as screenings and assessments for behavioral targets and autism screenings. Some basic dental care and fluoride supplementation will also be included as part of free services. Now, for toddlers and younger children, the well child visits will continue those screenings and assessments and even add more. For example, exposure to lead or risk for obesity. And once we get to your teens, in addition to whatever other screenings and assessments previously mentioned, there will be more. For example, for alcohol, tobacco, and use of drugs or potential use. Depression screenings, but also screenings for sexual health, such as hepatitis B, HIV, or sexually transmitted diseases. More immunization specifically for teens will also be covered. So overall, over the course of many years, both your child's clinical, medical, dental, and emotional health will be assessed and evaluated at no cost to your family. A note of caution though, any treatment that follows such screenings or assessments would no longer be considered preventive but therapeutic, therefore may incur a cost to you. Now for some helpful hints. First, the services are only completely free if the provider is within your plan's network, and I encourage you to find one by calling your insurance or visiting their online portal. Out-of-network preventive services would or might likely incur a cost to you. When you make a preventive care visit appointment and at the time the service is rendered, remind the doctor and the staff that this is a preventive visit. You don't want it coded as diagnostic, as this would again cost you money. For mental health services rendered to your teen, especially over the age of 12, be aware that some state laws will give your teen the right to seek such mental health services without your knowledge or approval. As far as insurance companies are concerned, in those states, they will be prohibited from sharing any information with you unless your teen has given signed consent. And same thing, medical providers will not share any medical records with you without that signed consent. Many advantages to using those free preventive services. They can catch a disease early, help better manage some conditions. They do save you money now with free services and down the line. For more information on this topic and more details as to what services are covered, I will place the links in the description below. And as always, I thank you for watching this video and for subscribing, commenting, or sharing. These really help this little channel grow to reach out to many more patients like you. Thank you.